Today marks 358 days since our first case of COVID-19 in Albany County. It's now been, believe it or not, 51 weeks, and we're entering 52 weeks. It's hard to imagine that it's almost been a year, and it's been a long year and a challenging year for New Yorkers, and challenging for anyone, being shut in, nursing homes, losing people. So again, thank you for everyone doing the right thing to help us get through it. But sadly, unfortunately, I have to report one more person passed away, a man in his 80s, so my thoughts and prayers go out to the family. For these difficult times to lose anybody, it's hard enough to lose anyone. But I hope I don't have to continue to say this, but it's hard to lose a loved one when you can't properly send that person off, and it's a lot better than it was 12 months ago when you couldn't have a wake or funeral. And a lot of people were doing private services, or still doing private services, that are going to do memory services later on when things open up so they can feel some type of normalcy. So again, to the 359 people that have passed away from COVID-19 since this began in Albany County, my hearts and prayers go out to your family. So as of today, we now have 20,795 cases of coronavirus in Albany County, and that's an increase of 91,000 positive cases. So total together, since this all started, was 20,000, but 91 positive cases. And yesterday it was 45, so we're steadily went up a little bit of a jump. On the 5-day average, it was 59.6. Yesterday it was 57.6, and that's currently 1,504 people that are under mandatory quarantine. And yesterday that number was 1,613. So just a little bit of an increase. Of the new positive cases, 24 have close contact to a positive case, 4 are with healthcare workers, and 63 don't have a clear source of infection. And like I was saying, 20,254 people have tested it positive for the virus and have recovered. We have 86 recoveries since yesterday, which is good news. There are 7 new hospitalizations overnight. There are currently 40 people in the hospital from the virus. Yesterday that was at 35, so we went up 5. We have 4 patients currently in the ICU. Yesterday that was 4. One of the questions we keep getting, and like I said, everyone, yes, we have a lot of recoveries, a lot of people that have recovered, people that went to the hospital. It's a long road for some people to recover. And I'll ask Dr. Whalen to talk about it, because my brother, who had COVID-19, was in the hospital twice, went just back in again for issues complicated from COVID-19. It's been a long time for him to try to heal from it. So I just take his scenario versus other people that are dealing with the same thing, that continue to go on, have lung issues, the long-term effects of COVID-19. And I'll let the doctor, if she know, I can't talk about it because I'm not the expert. I just know what I read and we put out. But there is a lot of complications that have happened with people that recover from the hospital. Even though they recover and they get home, they have a long road ahead of them. And so I say to people out there that still think that this is just something being made up or passed through. These people, yes, they recover. They're at hospital. They didn't pass away. Thank God. They just have a long road ahead of them. Not all of them, but a good percentage of them. So while the data is improving overall, we're still losing residents to the virus. COVID is not done with us yet. I keep reminding people, so you need to continue to stay safe and healthy. Please remember to wear your mask, cough in your arm, clean your hands, stay 6 feet apart, and we're going to get through this. Follow the health guidelines to keep the virus under the control. That's what we're doing, following the science. Dr. Whalen, I want to thank her and her team. We just follow the science. Have not tried to make political football of this. We've just been trying to get through this with the guidance that's in front of us. And remember, it has changed. What we faced with 12 months ago has definitely changed every month, every week, every second, and I've said that before. So again, we'll continue to get through it. For those who want to get the vaccine, please check the state website, 1-833-697-4829. I have not checked the Army's website. I have talked to people that are complaining now they can't get appointments well into April, that it's already booked out. So I don't know. I was trying to get on it before I came down here to see, but I've had quite a few people reaching out saying that there's no more appointments available till well into April. So just show that's good, because we need more people to believe in the vaccine and we need to get more out there. So I will check that out. The United Way 211 hotline, please, as well. They'll help you through it. They'll talk about vaccine appointments, questions, eligibility, where to go to set it up, so on and so forth, what clinics are available, and then our albanycounty.com website. Please, the bar across the top, which will send you to our COVID page, and we encourage you to pre-register as well as find out if you're eligible for appointments and if you want to get COVID-19 tested, where you can go and what age group falls into it, as always. The pre-registration list is also being used by other providers, like we said, across the state for vaccine sites at the Washington Armory and other things. Here's some of the good news. 20.5% of Albany County population has received its first dose of the vaccine. That's the second highest in the capital region. Warren County has us beat by 21.7%. So since January, Albany County has administered 7,865 first doses, 3,368 second doses at our clinics at the Times Union Center. Yesterday alone, which was impressive, went down again. It's great to walk through. I say to the media, I challenge you to walk through and see how this is done. To Dr. Whalen and her team. There was 1,600 first shots and 900 second shots. And it's a lot of people to get through. But again, to the medical corps, to the volunteers, there's a lot of volunteers that aren't in the medical corps that volunteer as runners and help out Dr. Whalen and her team to do things that they can't get to. But again, that was Mayor Patricelli from Waterville. Got to run into him when I was there. I was surprised to see him. Again, to everyone that was down there, please, thank you. So as we're expecting to do somewhere around 2,000 shots tomorrow for 65 and above, please register. Our website's out. We have some spots available, which is a lot of the thing that Dr. Whalen and I talked about. As we continue to push more vaccine, a couple more weeks, we're going to be begging people. And, with the Armory, Albany drive-through and everything else, this is good. This is a good sign. So please, we do have available spots. You want to get shots? Please go to our go online to the website. 65 and above, we're trying to change some of the rules for underlying health issues. But again, there's strict guidelines that we get that we have to follow from the health department. And Dr. Whalen can talk about it, but we can't vary from that. And when we're told it has to be 65, can't be underlying health issues, this is the push, that's what we have to do. That doesn't include the other initiatives and allocations like the Center for Disabled Service, the partnership with Mohawk Ambulance Service, the reallocation of 250 vaccines to Mohawk Ambulance, and the pod yesterday at the Metropolitan Baptist Church where we did 70. So I have Chairman Andrew Joyce here. I've said this has been a partnership with the legislature, with community members, and it was an initiative that Chairman Joyce in the legislature and Dennis Feeney and everyone else, and every legislator, I don't want to leave them out, I'll let Andrew talk about that, that wanted to get into communities and do something. And one of the things we did, my deputy and myself, Dan Lynch and I went to, and with Chairman Joyce, went to the Metropolitan or Baptist Church in where we did 70 people that were African American, and then I went to the Washington Armory, and I know that for this first week is for the underlying health communities, certain zip code in Albany, and unfortunately, we saw like 3 African Americans out of hundreds that were there, So it seems these smaller pods work better in the community. It seems that working with the legislators, and I'll let Andrew talk about that, and the common council members, Joyce Love was there, Wanda Willingham, and I'll let you talk about it because I don't want to leave anyone out. They'll all get mad at me, Baroa. But again, working with them, it seems to get more people out in them communities, which was a bigger number. It's something that Dr. Whalen's talked about constantly. We talked about, but our hands are tied of how we can change that. So I do want to thank you too, because it is an initiative for Dr. Whalen and her team to allow us to do these partnerships to get these pods up and going and communicating with everyone that's doing vaccines. Today also we're doing 180 vaccines in the Hilltowns. Knox Town Hall today is going on. I'll be stopping up there, and then we'll be doing Bern and Westerlo. So there's a need up there for the community. They have underlying communities, and they have transportation issues to get off the hill town. So we will be addressing that today. We'll be at the Knox Town Hall, City Hall today. So please stop by there if you want. We're also reallocating 100 doses that were sent from the state after my advocacy to the North Albany Legion Post with Chairman Joyce here, who worked with the Black Caucus, Bill Clay, and a variety of other members that made sure that we set this up and we got a pod there. And these are not going to be the only pods we'll be announcing today. Next week again, Chairman and I have been working on a variety of pods throughout, not just Albany County, throughout. Not just throughout the city, but throughout Albany County, of how we're going to make this happen as we go forward. So, again, Chairman, thank you, and I'll turn it over to you in a second. But on top of that, this Sunday afternoon, 400 vaccine doses are going to Waterfleet Senior Center for those living in that area, including residents of Cohoes and Green Island. Another initiative that when I was talking to the chairman and the legislators Bob Beston and Sean Ward and Allison McLean Lane to address them issues over there too. So if you haven't been able to get a vaccine, please use our pre-registration tool to look for appointments. We've had over, like I said, 30,000 people pre-register, 21,000 from Albany County, and almost 11,000 from the city of Albany alone that have signed up for this. It was overwhelming. We're working the kinks out. Dr. Whalen will tell you it's a good luxury to have, good problem to have. I wish I could sit here and tell you it's been seamless and we're doing it better, but we are making it easy on people. One of the things the chairman and I talked about, and Dr. Whalen a lot of times, was the issue of people pre-registering, the Hunger Games that this has turned into, and it shouldn't be Hunger Games, and it shouldn't be stressful for anyone who wants to get a shot, especially over the age of 65, or anyone in general that might not be computer savvy. Or doesn't know how to keep hitting refresh or know what sites to look for. If you answer the wrong question, it says you don't qualify. So you got to be careful how you answer the questions too. So it's really take your time, read the questions, and then when you look at availability, and I did go on that site where they'll tell you Potsdam has or I think all of upstate, Plattsburgh, Potsdam were not available. Utica, but the Armory in Bronx was available, and again, people shouldn't be crossing, driving that far to get their first vaccine or second vaccine. So please, let's work with us, get this through. But again, I couldn't have done this without partnerships, and I know I can continue to say that because it's hard. It's been 12 hard months on everybody, and I do want to thank the legislature for their partnership. But Chairman Joyce.
Thank you, County Executive. And again, as we do when we come up here, I want to thank yourself, your administration, and Dr. Whalen for all the amazing work that you have done and your team has done throughout the beginning of this pandemic. As the County Executive had mentioned, we went out to the pod of the Times Union Center last week. It's the first time I went out there. The legislature was giving out our Beyond the Call awards to Albany County's DOH staff and the Medical Readiness Corps that have been running that pod out of the Times Union Center. And I've said to people, and I can't stop talking about it, now, I was there when the Times Union Center opened and Frank Sinatra opened the place. I was there for the 1992 Royal Rumble when Ric Flair won it. But those were all spectacles and those were amazing things to see, but nothing compares to what I saw when we went out to look at that pod and look at what was going on in the Times Union Center there. Just a response. I'm incredibly proud as chair of the legislature and as a Albany County resident to all the incredible work that's being done there. But today we're here again to talk about vaccines. Again, I'll remind folks to pre-register. If you haven't registered yet, go to the link for albanycounty.gov and make sure that you pre-register for the vaccine. There's a lot of amazing work being done with product going out there and vaccine quantities being increased in the community. We have the site at UAlbany. We have the site opening up at the Armory. But one of the things that I challenged members of the legislature early on at the beginning of the pandemic was to come up with ways to connect resources in their communities going forward, whether it be PPE or hand sanitizer or linking people up with grant information. Now it's all about vaccines. So while we have these large pods opening up and continuing at the Times Union Center and at the Armory and at UAlbany and other spots, we're still focusing on these neighborhood-based small pods continuing in the neighborhoods. The county executive had mentioned before, we work with the Legislative Black Caucus, Chair Bill Clay and Wanda Willingham on identifying the need in the community. So what we did is we did a pod yesterday at the Metropolitan Baptist Church, 70 individuals with comorbidities. So we're talking about doing that more in the community, more in the neighborhoods, and we're hearing it. Folks that have pre-registered and they say, well, I'm ready to go in April, or I can't get an appointment till later on, or we're carpooling to Utica, or we're going to Plattsburgh. We hear you. So we do want to expand that. The county executive and his team and the Department of Health and Dr. Whalen have been very responsive in terms of getting the quantity and getting the vaccine to the county so we can open these pods up in the neighborhoods in the communities. Again, the Whitehall Road area neighborhood in the city of Albany, large senior population in the Whitehall Road area. St. Sophia's, Holy Wisdom, Whitehall Court. These individuals are still, they meet that criteria to get eligible for the vaccine, but they can't get out and get the vaccine. Transportation being an issue. And one of our charges and one of our responsibilities early on, and still is getting the vaccine to people that couldn't get it. They can't register, or they don't have the transportation to get to the different sites. So we do these community-based vaccines, we do these community-based pods, and we're going to continue that. So as we had mentioned before, we did the one at Metropolitan yesterday. We're looking at doing more with the senior population in along Whitehall Road, City of Albany. We talked about Waterville and Green Island and Cohoes. Just continuing to challenge legislators to identify the need in their communities, do more. And it's just incredible work. And the partnership with the county, with the city and Mohawk Ambulance to get these vaccines out has been incredible. So we're going to be doing more of that. We got a call this morning from a member of the Common Council of the City of Albany. There's Spanish-speaking individuals. There's a Muslim community. There's the Asian community. We need to do more to connect this resource with them in the neighborhood, in the community, to kind of neutralize that problem of registration and transportation being what they are. This is local government at its best, connecting residents with this life-saving vaccine so we can all get back to normalcy. And again, thank you, County Executive. Thank you, Dr. Whalen. You're our heroes, and we really appreciate it, and we'll just continue to work it.
Thank you, Chairman, and again, thank you for your leadership. And before I turn it over to Dr. Whalen, we still have that. We're doing homebound seniors with the Sheriff's Department, so that's going on. They got more vaccine this week to do that. And CDTA, Carmen Brazil, has been awesome with us, trying to do with bus transportation and trying to coordinate it. But a lot of seniors don't want to get on a bus. Just like, when I was at the Army yesterday, I was talking to a couple seniors getting off the shuttle. They weren't happy because they're been home, isolated by themselves, and now you put them on a bus with other seniors, and then they got to get off the bus to get into the Armory. Though it's convenient, and I commend Mayor Sheen and them for setting that service up, we hear it too, and I don't blame them. They've been home for 12 months doing the right stuff, staying away from everything, and the last thing I want to do is get in a panic of being on a crowded bus. Even though they're socially distancing on the bus, but to be on a bus and then get out and they feel like they're exposing themselves, but they want that shot. So we do have a need. It has fallen through the cracks. We've identified it here in the county about seniors and people that have been homebound that can't get out. And again, it's, I'm glad that's going forward. And before I turn over to Dr. Whalen, I keep advocating for our frontline workers, for our DSS, for our DPW, for our water purification. I was just talking to Mayor Sheen about this yesterday, and she feels the same way. We're restricted, but when you see other counties giving shots to their essential workers and we're being told we can't, like our public defenders do not qualify, but other places qualify them because they're officers of the court and they gave it to them. And same thing with the DAs and all them, and they didn't qualify. They qualify under OCA, but they don't qualify under Department of Health, which makes no sense. And that's what I said. It's the rules we got to follow. We've been following them. We have to adjust. It's their field, not mine. And I can only do what we can possibly do. And it was the same argument when we opened it up from 75 and then went to 65. And, again, when you crowd that field too much, it makes it an issue, right? Let's knock out the 75 and above. People with underlying health issues, they're the ones passing away from this. They're the ones that are affected the most. Seniors have been affected the most. So it would have made sense to me to do 75 and above, then do 65, underlying health issues. But again, it's above my pay grade. So, we can only work with what we're being thrown at us. And I do want to say I commend Dr. Whalen and her team for constantly adjusting. But Dr. Whalen.
Good morning. Thank you, County Executive McCoy, and thank you, Chairman Joyce. And in particular, I'd like to thank Chairman Joyce again for coming down to the pod and recognizing our Medical Reserve Corps and our staff. We have a really tremendous group of individuals, a large group of individuals who are freely volunteering their time to come down and assist in this incredibly historic public health effort. Hundreds of people giving of their time, coming and working flat out for periods of 8 to 10 hours to ensure that we can get vaccine out to the residents of Albany County. This is a very Herculean task, and this is something that we could not do without these volunteers. In addition, I would like to really give credit to my staff that have coordinated this effort, including Tricia Bulato, including Mevish Badi, and Stephanie Notar and Missy Gage, who are working as our Division of Public Health Preparedness to prepare the schedules, to get the links out, to ensure that we have good throughput, to monitor the situations as they go forward. We also have staff that have come to us back from retirement that are currently working for us, including Mary Brummagem, who is our previous vaccine coordinator, who is handling all the vaccine, and Eileen Franco, who has come to us, who has been indispensable as a pod manager. This is a tremendous effort, and I just can't say enough about the work that is being done on a daily basis, and I will say daily and nightly basis, because we have staff that are working, up to 20 hours a day to ensure that we can keep this going. My Deputy Commissioner, Mary Beth Miller, who I work hand in hand with, is a phenomenal counterpart, and it's a lot of work. It's a lot of work. So to have the legislature recognize this workforce and the work that they're continuing to do on a daily basis is really important to share the value of what they do, and it's greatly appreciated. We will continue to do this. This week we are holding 3 pods. This week we are looking at getting more vaccine out than we have in all previous weeks combined. And last week we administered over 2,400 shots. So it was a very busy clinic. It was, there were a lot of people that came through, and we are continuing always to work on issues like flow and wait time, and I've met often with people who are coming through the line that are incredibly grateful. People say, I don't care if I have to wait 6 hours. Our wait times are nothing like that, believe me. But people are grateful to get the vaccine. We get them through quickly, and they know that they're in good hands. We have local doctors and nurses that come and assist with these clinics every week. So it is a very well-run, medically staffed operation, and something that I'm incredibly proud of. This strategy has allowed us to vaccinate a large number of people in a short amount of time. But as you've heard from the County Executive and Chairman Joyce today, this is not a one-size-fits-all operation. We need to be able to have other ways to vaccinate people, and particularly when we're talking about high-risk communities, communities of color, and isolated communities, we need to be able to bring the vaccine to people so that they can be vaccinated in place. So these kind of community partnerships are essential. And I'm happy to say that the partnerships that we have are partnerships that have been forged before the pandemic. We have worked with our community partners in the healthcare sector, with our hospital partners, with our docs in primary care, with our EMS providers, with law enforcement, and certainly with other county staff and with the legislature, hand in hand on these issues for years and years. So this now enables us to bring these partnerships to a strength that will allow us to get vaccine where we need to get it. We know that we need to expand on what we're doing, and we have the ability, as we get increased supply of vaccine, to be able to do that. So on top of everything else, we're working these partnerships. We're working on strategic reallocations. We're working on getting vaccine to where it's convenient for people to get it. And what my hope is that as we go forward with this, the recognition that local public health is best positioned to know how to implement these strategies can be appreciated, and we will be able to make these decisions. It is essential that we can do this so that we can protect the health of the residents of Albany County. So I look forward to this continued effort. We have another pod tomorrow, as the county executive indicated. At this point, it is for 65 plus. Usually when we put out a pod link, it fills within about 5 to 10 minutes. We put this link out yesterday, and we still have a lot of spots. So, we're hoping that they will be filled, and we are hoping that if we still have capacity, we will be allowed to increase the scope of that clinic, because we know the most important mission is to be able to get the vaccine out, and we are ready and prepared to do that. In terms of the overall number of cases, we do continue to see a downward trend, but again, I want to, as I always do, continue to caution people that it is important to continue the measures that we have discussed here daily for the past year. We still need people to wear masks. We still need people to social distance and avoid large gatherings. We are concerned about the B117 variant, which is the UK variant, which is now a predominant strain in Europe, and we are seeing more evidence of communicability there. We are watching this carefully from an epidemiologic perspective, but the concern, of course, is that if we start to see this spread, we may see numbers spike again. And this is not what we want to happen. So it is essential that we advance the dual strategies of continuing to vaccinate as widely as we possibly can, and to encourage the strategies of personal prevention. As the county executive indicated, from a medical perspective, COVID is a very complicated disease, which we're learning a lot about. And there is the acute illness of COVID, and then there is the sequelae, which we are learning more about on a daily basis. We know many adults who have COVID go on to develop long-term complications, the long haulers, and that is a result of inflammation throughout various parts of the body, affecting multiple systems. This can really debilitate people for a period of time, and we want to avoid that. So the public needs to know that the sequelae are real, the acute disease is real. We have seen throughout the state very small numbers, but numbers of the multisystem inflammatory syndrome in children. I'm not aware of any cases reported in Albany County, but was on a call yesterday with the New York State Association of County Health Officials, and heard concerns in other parts of the states on that, so we want to make sure we keep our children safe as well. So it is important for parents, it is important for all that are in a position to be able to influence others to remember the importance of teaching how to protect yourself from COVID-19. We are at the point now where we can start to glimpse the finish line as we improve our strategies around vaccination and as supply comes into the area. But we need to be mindful, and we need to all work together so that we can get across that finish line, with the most minimal impact on the community in terms of disease, hospitalizations, and death. So this is continuing to be a group effort by all of us, and I continue to appreciate everybody that is continuing to work very hard on these efforts.
Thank you, Dr. Whalen, as always, and everyone else. So we had a NISAC meeting yesterday with the counties across the state and upstate, talking about the federal relief package that's coming and hopefully passes. And I do want to say to Steve Aquario, which I will have him on next week to break it down, but to Matt Chase from NACO, to Mike Griffin from County Executives of America, this is something we've been working on since last April, and I can't believe it's been 11 months of fighting for the stimulus package and what it's going to mean. So some of it is people who make under $80,000 are going to get a stimulus check for $1,400, which is good. And just to give you an idea, the breakdown that it's going to go to different counties in Albany County, which we all know Albany County is like 59 million. City of Albany is over 78 million. Town of Colonies, $8 million. And like the town of Bethlehem, $6 million. Town of Knox, where I'm going today, is $495,000, and so forth. We got the whole breakdown to what this stimulus check means and what it can be used for. There's restrictions that they can use it for. So it's going to be for obviously paying back for the COVID expense and everything else going forward. So there will be some strings attached to it. So as that gets passed this week in the Senate, and I do want to say to Senator Schumer and Gillibrand, but especially Schumer, thank you for your leadership. Thank you for making this happen. To all of our Congress delegation, especially Paul Tonko, thank you. This is much relief that we need, and it's going to help as we go forward. So, and if you look at the total aid that's for New York counties, it looks like it's roughly about 8% of the $65 billion to $60 million. And if you look at some of the changes, the aid likely for 2024 with further restrictions and other guidelines that are going to be out. So please, by all means, look at that stuff. And it's looked like the budget deficit for New York State is going to be down about $2.4 billion. So that means it's not as much as the $15 billion, which is still a deficit. And so that's a good sign that things are starting to recover. It's going to take time, and the stimulus checks are going to help. One of the things that we did receive was $207,000 from the federal government for COVID-19 infectious control stimulus funding for doing a good job at our nursing home, on top of the well over $1 million we received in the last year from the federal government for our nursing home. So thank you for that also, and thank you to the staff at our Albany Shaker Rehabilitation for doing a great job out there and continuing to do a good job. I also want to advocate again. I'm playing phone tag with Larry Swartz about our workers, opening up for not people with just underlying health issues, to all of our essential workers. And there's too many to list in Albany County, and not just in Albany County, in the city, to private businesses, to the media. And it makes no rhyme or reason. If you look at CDC guidelines or you look at other states, some states do media, some don't. But you are vital. Not all the time when you're getting on me, but you're vital when I like what you're saying. Not all the time with everybody, but the reality is when people are shut in for 5 months, that was their lifeline. That's what they heard. That's what they want to know what was going on. And you were here every day with me when we were meeting in the height of the COVID-19, at the height, at the low, back at the high, and now the low. You're out there informing the public whether I like the messaging you're putting out there. Or not, it's vital to the papers, putting stories out there. It's vital to people's mental health and to let them know what's going on and how the world's changing around them. So I in the news media, I don't understand it. It's some of the things that baffle me for the last 12 months, rhyme or reason who decides this, instead of talking to the people. And I say this, and it's a military terminology, Chairman Joyce, but Major in the National Guard use. We're in the trenches, and we see what's going on in the communities, and we see what's vital. And I think sometimes state government and federal government tend to forget how we operate and what we need to operate and what's essential to us, because they either never went through the counties or city, towns, or villages. They just went straight to the Senate or the Assembly, or they went to the governor's mansion, or they went to the Senate, or House. But talk to us. We do know what's going on, and we want to be a good partner, but it's important to do this. Some of the other exciting news: the Times Union, we are limited with the NCAA men's hockey regions that are going to be here March 27th and 28th. If it was in April, we could have 33%, but we're limited to 10%. So them tickets will go on sale March 8th. So again, and stay tuned for some great announcements we're going to have at the Times Union Center as we continue to open up in a safe, scientific manner. So it's been a year now since we've been able to enjoy sports at our arena, so please, this is going to be great. The light at the end of the tunnel is here. We're getting there. Please, but people can't have COVID fatigue, and we have to continue to do the right thing. As always, please, we have mental health support available 7 days a week, 8 a.m. to 5 p.m., 518-269-6634. If you're looking for vaccine information, as always, dial 211. Our 24-hour sexual assault hotline number, as always, Karen Ziegler and your team, thank you for what you do all the time, 518-447-7716. And again, please continue to wear your mask, cough into your arm, clean your hands, stay 6 feet apart. We're getting through this. We've got a couple bumpy roads ahead of us with the vaccine still getting out, and hopefully with these other strains of the virus. But please stay safe out there.